Next at 7, the new health care bill faces its first test, how the proposed changes could impact you.
Live from San Diego, this is the Fox 5 Morning News at 7.
Congress has proposed changes to the current health care system, and here to break down, or at least try to, what this means for your plan, Craig Gussin, who's been a very busy man the last 24 hours or so. Craig, good morning.
Morning.
Okay, help us, please, if you could, understand what the new plan entails compared to Obamacare.
The biggest difference is that instead of having 4 plans to pick from, you're going to have a much bigger list of plans. Before you had basically the government said, here's the 4 plans, pick what you want. What you're seeing Congress now come up with, and the president mentioned during his speech last week, is that they want to take let the consumer pick the plan that works best for them versus the government picking the best plan for them. So those are one of the things, the changes that we're seeing. They got rid of most of the taxes. So all these taxes that they had one tax called a health insurance tax that would cost a family of 4 $500 a year. So they've gotten rid of a lot of the taxes that's going to increase the cost. Health insurance is expensive because health care is expensive. So one of the things we need to do is reduce the cost of health care. I was in Washington, D.C. a couple weeks ago, and the thing that they talked about is market stability and transparency. If you go and you get your car fixed, you know exactly what it's going to cost when you walk in. But when you go to a doctor or hospital, you have no idea the cost of a colonoscopy, a hip surgery, anything you need done. So what they want to do in Congress is also, and I haven't seen it much in the 6 pages that came out yesterday, but what I have heard is that they want transparency so people know exactly what they're buying and they can shop it for a lower cost.
Okay, some healthcare experts yesterday, everybody was being interviewed, and a lot of them said that if you agreed that Obamacare was not a good plan, they're saying that this new thing is not that much better. Do you agree with that?
I like a lot of the things it's done. One of the things it did was...
Which one, the Obamacare?
No, the new one.
Okay.
Sorry. With the new plan, they made some changes, such as that instead of having an age ratio of 3 to 1, it's 5 to 1. And what that means is the difference between a 20-year-old and a 60-year-old, the rates can be like from 500 to 100, 5 to 1 ratio. Under Obamacare or the ACA, it was 3 to 1. So if a 60-year-old was paying $500 a month, then a 20-year-old is going to pay $175. So you're going to see the cost for younger people go down. I happen to like the tax credits. I think it's a good thing. The only concern I have with that is they give tax credits now up to $75,000 a year of income, which I think is a little bit high because before the subsidies were only based on income up to about $45,000.
Yeah, I know that you've looked through some of this. A lot of folks are saying that this may not make it through the House in its current form. Some conservative Republicans saying that this is not good enough. What happens then? Do more changes need to be made in order to get it past the House and past the Senate?
I think this was a proposal.
Sure.
I think a lot of changes are going to be made. And you want to understand that when the ACA was put together, they had all these taxes in it. Even though none of them ever came to fruition, they were all there, and it made the cost of the whole plan so much cheaper. Now that the government, the House has basically taken out all of those, it's making the plan look that much more expensive. But it's a numbers game. So I think what you're going to see is you're going to see both sides sit down and work on this. What really surprised me when I was in Washington, D.C., was how everybody on both sides of the aisle were getting along and working together. And everybody I heard said the same thing. We want to make this work. So I think what you're seeing right now is just a proposal. You're going to see a lot of changes, but it's a start. And I think that's where we're at today.
A lot of politics going on with people's health care.
A lot.
Yeah, bottom line here is people sitting at home who don't really get how any of this works when you're looking at hundreds of pages of paperwork written up by lawyers and politicians and what have you. People at home who are worried, what should they do right now? Should they be worried about losing their current insurance? Should they be worried about having to buy new health insurance? What do they do right now? Wait it out?
Wait it out. Nothing. Nothing's going to change. First of all, part of it says it's going to happen in 2018. That can never happen. There's not enough time. The insurance companies have to go and first get something approved. Then they have to go and price it and come out with the new plans. Then they got to get it to the insurance commissioner. The insurance commissioner has to approve it. There's no way physically possible it can get done by 2018. I'm guessing probably 2019,
really?
2020. It's just going to take time. It took the ACA 4 years to go into place. So they're not going to rush into it. I tell everybody I talk to, please don't worry about it. They're not taking away the ban on pre-existing conditions. So everybody,
which is important,
it's very big. So people are getting all up in arms because they keep hearing these articles. I saw these town hall meetings the last couple of weeks when the legislators were in town, and people were all upset they're going to lose their coverage. But I've never seen anything in writing anywhere that talked about they're going to take away the ban on pre-existing condition and some of the other things that really worked under the ACA.
Okay, so folks, with Obamacare, the bottom line here is while this is all getting worked out, you shouldn't worry that you're going to get dropped. You will not be dropped until everything gets settled.
And it's a long ways away. If we sat down 6 months from now and looked at maybe what was passed or what's about to be passed, it's going to look a lot different in some aspects than it is now, especially the people who are getting a lot of on Medicaid or Medi-Cal in California. I think it's 1 out of 3 people nationwide, I've heard. Those people, don't get upset. It's all going to work out. The biggest issue I heard when I was talking to legislators on both sides of the aisle was how do we fix those, how do we help those people? That was the #1 issue. Once they got that done, they said the rest of it was pretty easy. So just give it time and let them all work it out and come up with something that's going to work for everybody.
All right. Craig Gussin, we thank you very much
pleasure.
for your analysis this morning.
Take care, Ola.